Welcome to Inanna Board Review. In this lesson, we will review protein synthesis and serum protein electrophoresis, also known as SPE. This topic is important in clinical chemistry because protein patterns can help identify liver disease, kidney disease, inflammation, immunodeficiency, and plasma cell disorders. Protein synthesis. Most plasma proteins are produced by the liver. This includes albumin, alpha globulins, beta globulins, complement proteins, and many transport proteins. Plasma cells, on the other hand, produce immunoglobulins, also known as antibodies. This is important because liver disorders usually affect albumin and many globulin fractions, while plasma cell disorders usually affect the gamma region. Protein abnormalities. Protein abnormalities may occur because proteins are not being produced, are being lost, or are being overproduced. Low total protein may be seen with liver disease, nephrotic syndrome, burns, or malnutrition. High total protein may occur with dehydration or increased immunoglobulin production, such as in multiple myeloma or Waldenstrom macroglobulinemia. Always ask, is the protein low because of decreased synthesis or increased loss, or high because of concentration or overproduction? Serum protein electrophoresis. Serum protein electrophoresis separates serum proteins based mainly on their charge and physical properties. At an alkaline pH of about 8.6, most proteins carry a negative charge and migrate toward the anode. Albumin moves fastest because it has the greatest negative charge. Serum is preferred over plasma because plasma contains fibrinogen, which may create an extra band and cause misinterpretation. Normal SPE fractions 1. A normal SPE pattern has 5 major fractions. Albumin is the largest peak and is responsible for maintaining oncotic pressure and transporting substances such as hormones, bilirubin, fatty acids, and drugs. The alpha-1 region contains proteins such as alpha-1 antitrypsin and alpha-1 acid glycoprotein. The alpha-2 region includes haptoglobin, ceruloplasmin, and alpha-2 macroglobulin. These alpha fractions often increase during inflammation. Normal SPE fractions 2. The beta region contains proteins such as transferrin, hemopexin, beta-lipoprotein, complement proteins, and sometimes CRP during inflammation. The gamma region contains immunoglobulins, IgG, IgA, IgM, IgD, and IgE. A helpful way to remember this is gamma means antibodies. So when the gamma region changes, think about immune activity or plasma cell disorders. SPE pattern interpretation. SPE is a pattern recognition test. Increased alpha-1 and alpha-2 fractions usually suggest inflammation, infection, or tissue injury. A marked alpha-2 increase is important in nephrotic syndrome because large proteins such as alpha-2 macroglobulin are retained. A sharp gamma spike suggests monoclonal gammopathy, while a broad gamma increase suggests a polyclonal immune response. A beta-gamma bridge strongly suggests chronic liver disease. Monoclonal gammopathy. A monoclonal gammopathy appears as a sharp, narrow spike, usually in the gamma region. This occurs when one clone of plasma cells produces a large amount of identical immunoglobulin. Conditions associated with monoclonal gammopathy include multiple myeloma, MGUS, and Waldenstrom macroglobulinemia. When an M spike is found, immunofixation electrophoresis is used to identify the specific immunoglobulin type. Polyclonal gammopathy. Polyclonal gammopathy produces a broad, diffuse increase in the gamma region. This happens when many different plasma cell clones are stimulated at the same time. It is usually reactive, not neoplastic. Common causes include chronic infections, autoimmune diseases, chronic liver disease, and HIV infection. Board Pearl, narrow spike equals one clone, broad increase equals many clones. Beta-gamma bridge. A beta-gamma bridge means the normal separation between the beta and gamma regions is lost. This pattern is classically associated with liver cirrhosis and chronic viral hepatitis. It happens because increased IgA migrates toward the beta region and blends with the gamma region. For board exams, remember, beta-gamma bridge equals chronic liver disease. High-yield SPE review. Let's quickly review the major patterns. Normal SPE shows 5 distinct fractions. A narrow M spike suggests monoclonal gammopathy. A broad gamma increase suggests polyclonal gammopathy. A beta-gamma bridge suggests chronic liver disease. A decreased gamma region suggests immunodeficiency or protein loss. SPE is a screening tool, and abnormal patterns are confirmed with immunofixation when needed. Series overview. This card connects the fractions with their key proteins and functions. Albumin maintains oncotic pressure. Alpha proteins include acute phase and transport proteins. Beta proteins include transferrin, complement, and lipoproteins. Gamma proteins are immunoglobulins. The important point is that SPE tells a story about protein production, protein loss, inflammation, and immune activity. Serum protein fractions. Albumin normally represents the largest percentage of serum protein. Alpha-1 and alpha-2 are smaller fractions but become important in inflammation. Beta proteins are involved in transport, complement activity, and lipid transport. Gamma proteins represent antibody activity. Exact percentages may vary by laboratory, but understanding the relative size of each fraction helps recognize abnormal patterns. Final SPE pattern interpretation. The clinical value of SPE comes from recognizing abnormal patterns and connecting them to disease. A monoclonal spike suggests plasma cell disorders. A polyclonal increase suggests chronic immune stimulation. A beta-gamma bridge suggests chronic liver disease. Hypogammaglobulinemia suggests immunodeficiency or protein loss. Always correlate SPE findings with the patient's history, other laboratory results, and confirmatory testing such as immunofixation. Thank you for studying with Inanna Board Review. We hope these protein synthesis and serum protein electrophoresis review cards helped simplify this high-yield topic and strengthen your board exam preparation. To download your free copy of the complete study card set, simply scan the QR code on your screen now. The PDF is yours to keep and review anytime, whether you're preparing for the MLS, CLS, or board certification exam. If you found this lesson helpful, please like, subscribe, and share to support the channel and help other laboratory professionals succeed. Thank you for watching, and until next time, understand, analyze, and excel.